the sweeping table. All right, so this is the ankle protocol, and I'm just going to go down this in order. We'll be adding to these protocols, but for right now, this is what we have. We have the ankle pumps first. Make sure that the person does that in the elevated position when you're having them do ankle pumps at home. I don't think the home exercise actually shows that, but elevated, in fact, let me show you how I'm going to ask you to do that. Lay down on your back with your head right here. Perfect. And I'll put this underneath you, tighten your stomach. There you go. So when we're doing elevated ankle pumps, in general, that's the position. Sometimes it's a little uncomfortable because the heel wants to dig into the wedge here, so I'm going to add this right across there. There you go. Just to kind of get the heel off of that. And that also gives me a position that I can work on this. I'm getting a little bit of a gravity effect here to get rid of some of that swelling, but try to get them to elevate when they're doing the ankle pumps, ankle ABCs, dorsiflexion stretch. This is where, again, you go to Home Exercise Pro, you will see stretching being done from this position and trying to get a little bit of dorsiflexion. Forgot that Luke is kind of ticklish there. Now, just going down the list from here, we can do some soft tissue work in the supine position. And, you know, generally, we're trying to improve mobility here. And so this would be something that oftentimes we would delegate to one of our massage therapists. But especially on an acute ankle, we're going to want to do some distal to proximal soft tissue massage. I'm not going to get into the actual technique. Everybody knows how to do that. But distal to proximal soft tissue, if there's some tendonitis in the musculature there, you can do some tack and stretch where we find the peroneal muscles there, and we try to get between those muscles, tack them down, stretch those in each direction. That's just a good way to release the muscle bellies, whether it be the calf or the forearms. These muscles should be sliding on each other, and when you have an inflammatory reaction that takes place, muscles tend to stick together. They get little adhesions that form between them, and we want to be able to break those adhesions up. So getting in between those muscle bellies, combining that with some active release techniques can be very helpful. As far as joint mobilization goes, you know, this would, the simplest and safest is just to grab the calcaneus and the talus area here, and then just do some distraction like that. So this is something that generally anybody can do that's been trained just a little bit. So this is a good safe one. Sometimes we'll combine a little bit of traction with some dorsiflexion. That gets a little bit, you know, higher grade. But this is just some real gentle, general mobilizations that can be done. And then the Graston technique, I don't use that on the ankle as much. Sometimes we'll do that in the shin position. And since we're talking about it, though, let me go ahead and grab that. This is something that you want to warn the patient that this will leave a red mark. This is definitely not to be done in an acute situation. This is only for a more chronic condition where you have a lot of scar tissue that's built up, and some scar tissue we just can't work out with our hands, but these tools seem to do the trick. Not very comfortable when we're doing it at all. You got to warn the patient. Try to, you know, prepare them for the worst, and then they'll find it's not so bad. There will be some redness underneath this. You might want to get a shot of Luke's face there so you can see how he's squirming. But I'm just running that tool just back and forth like that. It turns red where there's some scar tissue, and it only takes, you know, about 4 or 5 minutes to really work an area out when you're doing that. I'll get the lotion off of you real quick, Luke. Or here, better yet, you can wipe that off yourself. So, as we're still on this ankle subject here, we can do low-level laser in here, and remember, here at McGuire Physical Therapy, everything we do is with a purpose to either stabilize something or to mobilize it. In this case, we want to stabilize an ankle. So when we're doing low-level laser, I could combine that with a little bit of isometric because, well, for one thing, we don't charge for laser. We don't charge for a lot of modalities. That would be double billing. But we do charge for therapeutic exercise, therapeutic activity. So in this case, Luke, I want you to hold your ankle in this position like that. Okay, I'm going to start doing some low-level laser here. And as I'm doing that, Luke, don't let me move you. Don't let me move you. There you go. And don't overcome my resistance. Just keep it right there. There you go. And then we're going to go the other way. So this is how we're combining multiple angle isometrics with the laser. You don't have to be doing the isometrics the whole time, but you can certainly be doing those during the laser activity. You can do these at multiple angles. So Luke, I'm going to move you into just a little bit and relax there. I'm going to move you down and over. Okay, don't let me move you. There you go. Relax, don't let me move you. So that's a multiple angle isometric that can be done with any joint. I see them in this position. Again, we have them elevated. We're going to want this to be compressed a little bit. Luke, ice is not fun. I hate icing myself, but it can be very helpful. We are going to expect this to be cold. It will burn a little, it'll ache a little, and then it'll go numb. If a person has numbness already, I probably wouldn't do ice. Okay, and relax. And then see how I wrap that underneath first. It's just a more comfortable way to do it for the patient. And then you wrap that over like so. And nice and relaxed. And this is where, we're going to be finishing on ice. Luke, I'm going to set you a timer here for 15 minutes, okay? I'm going to go all the way around with that timer, going to come back to 15, and then I'm going to set that up here. And whenever you hear that timer go off, you can unstrap yourself here. Be careful when you're getting up, and you'll be good to go. If you need to just kind of relax and use the room for a while, I will not be needing it for a couple hours. If you want to take a nap, you're free to do so. Get away from the wife and kids and just kind of have some solitude. I actually had a person take me up on that because she had the kids at home that she just needed to retrieve from. So she slept in the room for about an hour. Took their ice off first, so make sure they take their ice off. As far as gym activities go, Luke, I'm going to have you hop on up from there, and we're just going to go through a couple of gym